It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated patients and medically complex patients at home instead of intensive care. In last week's blog, I talked about how to go from hospital ICU to intensive care at home, the discharge process. You can check out last week's blog by clicking on the link below this video. And if you're watching this video on YouTube, go click on the link below this video in the YouTube channel. In today's blog post, I want to answer a question from one of our clients and readers, and the question today is: the ICU doctor is pushing us for end of life for our son, but we want him home instead. Can intensive care at home help us to bring our ventilator-dependent son home? Hi Patrick. The precipitating event for my son to go on an aspiration pneumonia was in the context of a rare brain disease, Rasmussen's encephalitis. His course over the last 11 months has been to stay in ICU, and he's still there at present. This has been complicated by a hospital or by a ventilator-associated pneumonia and severe malnutrition. The most probable cause of failure to wean my son off the ventilator is chronic muscle wasting throughout his body, with some lung tissue scarring due to multiple pneumonia events. The Rasmussen's encephalitis has been treated and not progressed per neurologist, but has left my son Jeffrey with a significant left hemisphere defect. My son can often tolerate up to 24 hours of spontaneous breathing with pressure support of 12 ppb, FiO2 of 28%, but then can only manage about 60 minutes of tracheostomy with a tracheostomy collar. Many of the experienced ICU doctors and ICU nurses we've seen believe he's capable of weaning, but the current ICU doctor believes he will be ventilator dependent for the rest of his life and is pushing us for either end of life or to stay in ICU for longer, but we want our son home irregardless. I hope this helps to look at our son's situation. We want him home with your service. What are the next steps? How can you help us in this situation? From Tom. Hi Tom, thank you so much for detailing your son's situation. Well, it sounds to me like your son is a very good candidate to go home, especially after 11 months of intensive care at home. It's terrible to hear that, and many of our clients that we look after at home have been in that predicament of having been in ICU for months on end. And whether he can be weaned or not, I couldn't tell you at the moment. I mean, we would need to talk to the doctors, but in any case, after 11 months of ICU, it's time to get out there and go home. Sometimes people can't be weaned in ICU because they're simply depressed, they're deconditioned, and they're not having any quality of life. They're stuck in an ICU room or in an ICU bed space or in an ICU cubicle, whichever way you want to call it, often with no natural daylight, often with no natural day and night rhythm. And because the lights are on in ICU often 24 hours a day, and there's people everywhere, it's loud, it's noisy, and people are doing things all the time. It's therefore very difficult to get in a normal or natural day and night rhythm, which is critically important for recovery. And unlike at home, where your son could, for example, go on the balcony, he could go on the veranda, whatever your setup is, can go and get some fresh air, can have a routine that is conducive to your son's lifestyle. At the moment, his routine is dependent on the ICU schedule, and ICU schedules are very busy. So at home, it is much more tailor-made to your son's wishes and to your son's situation, and not dependent on ICU schedules. So I'm also not surprised that ICU is trying to push your son towards end of life because they need the bed. And again, we here at Intensive Care at Home, we're creating a win-win situation for everyone. So we're creating a win for your son. We're creating a win for you as a family, of course, because you can finally stop visiting your son in ICU. And you haven't mentioned that maybe you can't visit your son at the moment because of COVID. So, but in any case, the win is for your son. The win is also for the ICU to free up that bed. And the win is also for the funding body to save half of the cost of an intensive care bed. Having said that, I do believe what we do in general can't be weighed up in monetary terms, because it's so invaluable for patients' families and for intensive care units. Also, given that your son is so young with only 30 years of age, ICU is definitely not the right place for him. He needs to live his own life at home with his family and not living in an intensive care unit. I hope that helps, Tom. Wishing you all the best for now. If you want to go home, we need to look at finance, of course, and one way to finance your son's stay is, for example, to look at health insurances. They would have an interest in reducing the cost of the ICU, but another option is here in Australia, the NDIS, the National Disability Insurance Scheme. Other options are, DVA, Department of Veteran Affairs, or the motor vehicle accident funding bodies if a motor vehicle accident, for example, led to a long-term injury. Other opportunities for funding are hospital funding directly, so you should contact us so we can guide you in how to take the next steps. Now, if you have a loved one in intensive care and you want to go home with our service, Intensive Care at Home, and if you want to find out how to get funding for our service and how it all works, please contact us on one of the numbers on the top of our website, or simply send me an email to patrick@intensivecareathome.com. That is Patrick, just with a K at the end. Please also have a look at our case studies, because there we highlight more about what we can do for clients, how clients can live at home with ventilation and tracheostomies, and you can look at our case studies as well as our service section. And if you are at home already and you need support for your critically ill loved one at home, and you have insufficient support or insufficient funding, please contact us as well. We can help you with all of it. And if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have a critical care certificate, please contact us as well. Check out our career section on our website. We are currently hiring for ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, northern suburbs, Mornington Peninsula, Frankston area, South Gippsland, Warragul, Druin, Trafalgar, Moe and Tryda area. We are, as I mentioned, an NDIS, TAC and DVA approved community service provider in Australia. Also have a look at our range of full service provisions. We are also providing specialist support coordination for our clients that need that level of care, and most of them do. Thank you for watching this video, and thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I will talk to you in a few days.